Hi everyone, it's Dr. Miguel here from Climbing Rehab, and I've been a climbing physical therapist for the last few years. So basically specializing in all types of climbing injuries, working with recreational and competitive athletes in the rock climbing world. And recently I actually had a finger injury clinic hosted by Miguel Zevallos in New York City. So I wanted to kind of give a little intro here, kind of what I do with that and kind of like the typical population that this would be useful for. So I found a lot of success with these finger-specific injury clinics since rock climbing is inherently a pretty hard sport on the fingers, and it's one of those injuries really that you won't really see in a lot of other sports or activities. And so having someone that actually specializes in these types of injuries, I found super useful in its recovery because a lot of times doctors or any other healthcare professional without really that much of experience in the fingers will often tell you to take a break from climbing or simply lower the intensity, the volume, without actually kind of getting specific into how I want to rehab this in the first place. So for this finger injury clinic, I go over the 5 main finger injuries that I see. The first one is probably the most common you guys might know of, which is going to be your pulley injuries. And this is going to be your more traditional kind of like you're pulling hard and then all of a sudden you hear that pop, right? So that's like the most common one that I see, and I went into a lot more detail in the clinic itself. But another one that I see a lot of times in your more kind of outdoor based or very board climber, board type of climber, is that pip synovitis, which is where you see that knuckle over here being a little more swollen. It can happen in the pip over here or dip, the proximal or the distal. Another one from the clinic that I went over in a lot of detail are your lumbrical injuries. That's probably number 3 in what I see the most of. And that's really the only one that is muscular based. Has a couple pros and cons. Pros being that it heals the fastest since it is a muscle and it has the most blood flow. But actually, it's probably one of the most painful since it has all those innervations over here. And you'll find that kind of like in that palm over here. You also have the collateral ligament injuries, which kind of pairs pretty well with the joint synovitis. It's actually on the sides of the joint themselves and helps prevent any kind of like opposing sideways motions into those fingers. So if you try bending those fingers sideways like this, it really shouldn't move too much. That's a good thing. Those ligaments are preventing that excessive motion. If you do have a lot of that motion, it's probably that the ligament is probably sprained in some way. And then the last one that I really talked about a lot in the clinic is your flexor tendinosynovitis. And this is your inflammation of the entire tendon sheath. Whenever you feel pain that isn't very localized, like going from multiple areas in the whole finger, going even into the palm and into the forearm, that's probably going to be what this is. And it's an inflammation of the entire tendon sheath, right? So it's not very localized to one specific area. You can kind of find it in multiple areas. And this one, as treatment goes, you'll kind of see that it's a lot more kind of tricky to have a more specific approach to it. We have to kind of modify a little bit more of how you're climbing. In the finger injury clinic, I actually went over some of the more common causes of these injuries, how to test them, how to treat them, and then in general how to apply it to the wall. So if there's any kind of like specific things that to look out for, from things to avoid while climbing, we kind of went over all of that. And then actually taping is like the big kind of buzzword around kind of how to treat yourself. You know, I'm sure you all know about like the H taping, kind of like putting some stuff on the finger to prevent that bowstringing, kind of that finger pain. And it's recommended for some injuries. For example, for your pulley injuries, you have the H tape that is the recommended one. And in this video, you can see kind of an example of me doing that. Another one that I'd recommend it for is collateral ligament testing or taping for that. And that you actually want to like tape up the side of that finger. So I show that in the video as well. And then the last one is going to be your buddy taping for lumbrical injuries. And this one's no-brainer. You kind of just try to prevent the bending of one finger without the adjacent or next to a finger to prevent that kind of like pocket shearing force. And with all these kind of things, that tape is used as a way to kind of like try to still be able to climb while not further injuring that site. But I would not really think of this as like preventative measures or full-on treatment for this as a whole. And something like a joint synovitis or the tendinosynovitis, those really won't get much better or have any really use by tapes. My favorite part about the clinic is actually the testing that we get to do at the end. It's a nice interactive part where we're basically just kind of testing your finger strength in an open hand in a crimp position. And this is to kind of really show the difference from one side to another. People get really competitive and try to beat one another, but really it's to see if one side is pulling, let's say, 80 pounds and the other one is 60, it's suggestive of either some type of injury or at the very least like a very large difference in how you're training, and could be more of a precursor to injury or some type of like imbalance that we should address before it turns into something bigger. For this, I especially like to kind of like go over what the normal percentages that you should expect. Anything above 10%, like I said, is something that you should consider either changing up the way you're training or at least stopping the amount of intensity that you're doing something, if it could be more of an injury. Anything above 20% for sure is suggestive of some type of injury. And we can use this from a training perspective too, to try to actually bring up those numbers in a nice, efficient way without overloading our tissues. Ultimately, rock climbing is one of those sports that it's really hard to stay completely injury-free, especially if you do it for long enough. And so my advice here is if you are dealing with some type of tweak or small injury, and you've already tried rest and some light exercises, after 2 weeks, it's probably time to reach out to someone. And preferably that someone, whatever local provider you go to, should have some type of experience with treating rock climbing injuries. It's just a very specific sport, and we want to be loading these structures up in a more climbing specific way to let those structures heal and be able to tolerate the normal loads of climbing. Hope you enjoyed this video and this was useful for you.